Good morning. Welcome. We are so excited to see you all here and have a chance to connect with you, have you connect with each other. Please feel free to say hi because everybody has the same goals in mind for this work. Before we kick off the presentations and panels for today, I want to recognize my colleagues from the Community Foundation for Southeast Michigan. Am I standing too close to the mic, you think? Okay. So first I want to introduce our president and CEO, Rick DeVore. Say hi, Rick. And I really want to thank you for the incredible leadership the Community Foundation took this on when it is, outside of our region. We are statewide, but our amazing partners, which I'll get to later, other funding partners, really have helped us along the way. So thank you, Rick. I also want to thank our finance and legal teams and our communications colleagues too, all of whom can't be here, but they really have worked hard to make this all work. So thank you. I also want to recognize another key partner. That's the Michigan Health and Hospital Association. They're also throughout the room, but also at these two tables. It's been really wonderful to get to know the MHA even more closely than we did in the beginning. We started talking a long time ago, I would say, and it was through our Michigan Opioid Partnership funders that we really connected, and now we have weekly calls and strategy, and it's been a true pleasure. Yeah, thanks. Okay, great. I'm also joined by my colleagues at from the Michigan Opioid Partnership, and what's really wonderful, let me advance, I'm not paying attention here. There we go. Okay, these are our funding partners, and I need to basically thank a couple of the funders in particular who, right from the beginning, helped us connect to this work on a state level. As I said, we're regional to Southeast Michigan, so it was really incredible. So Blue Cross Blue Shield of Michigan, Blue Cross Blue Shield of Michigan Foundation, and the Michigan Health Endowment Fund were key in the initial birthing of this work, so thank you to my partners there. And I want to recognize the Michigan Opioid Partnership's co-chairs. So Linda Zeller, who's right here from the Michigan Health Endowment Fund, hello and thank you. And then Audrey Harvey from the Blue Cross Blue Shield of Michigan Foundation. We're grateful for your leadership. Thank you. So, what have we been doing? Thanks to MDHHS, the state funding, it's been incredible. We've made wonderful strides in the work. We've granted over $7 million to date to support hospitals, jails, community foundations, and nonprofits. Really, we've had some amazing partnerships to help move that work. So starting with our jail-based work, early in the days, Michigan Health Endowment Fund had started working with Wayne State University Center for Behavioral Health to really look at screening and treatment accessibility in our state's jail system. The Michigan Opioid Partnership was able to capitalize on that, leverage it, and expand it, which has been really wonderful. We also received some funding from Vital Strategies, who's also listed on here, an international public health organization, to work in harm reduction by funding community foundations across the state, and community foundations are everywhere in the state, and they worked locally on the ground with their partners to really stand up some amazing harm reduction efforts. We also, of course, have worked in the post-overdose area, which really thanks to the Department of Health and Human Services, we were able to kind of add that onto our work, and a number of quick response teams were funded throughout the state. Those were so successful, and the group was so cohesive that we still hold quarterly calls with Wayne State Center for Behavioral Health and Justice with all the original teams from those groups. And what's really exciting is they're so excited about the work, whether they have funding on their own or not, we still convene quarterly. So that's a really wonderful, sustained model for connecting. So lastly, what we're here to talk about today is our emergency department medication for opioid use disorder initiative. We're going to be highlighting that throughout, and I especially want to thank Johns Hopkins University, because their evaluation has made an incredible difference in how we look at the work and our accomplishments to date.